It's 8 minutes past 8 on Tuesday, May the 13th. And we're looking this morning at a new report which is out showing the link between poor mental health and debt in this part of the country. The research has been carried out by National Debtline, which provides free advice to people worried about money. It shows that over a third of those behind on household bills in this part of the country suffer with poor mental health as a result, a 20% increase from people who don't struggle with their finances. Alex Michael from Norfolk and Waveney Mind joined us a bit earlier on.
From the data that we've seen from listening to our clients over the last few years, we've realised that there is a huge link between debt and mental health. Again, that vicious cycle, so a chicken and egg situation. And we've gone a long way in creating those relationships. We signpost to, 3 charities now. We've seen that evidence that by linking them up together, it's making a huge difference.
Mark Hitchcock is the Chief Executive of Norfolk Citizens Advice and joins us now. Morning, Mark.
Morning, Chris.
Would you go along with this research? Is this something that you recognise, that there is quite a strong link between debt, financial problems and poor mental health?
Yes, it's unquestioned. We've known this for some time. I think it's great to get new research showing this. We know that at least half of our debt clients have mental health issues. So there are quite a few people waiting for mental health support in Norfolk face debt, at least 25%. So yeah, it's completely inextricably linked. And I think, your listeners will be aware if they've ever owed somebody or if they can't pay the bill at the end of the month, then that raises anxiety in all of us. And when that happens on scale and repeatedly, then it can lead to serious mental health issues.
So as a general trend, what do you think you see? Do you see mental health problems that are caused by debt, or do you see somebody in debt that then leads to the mental health problems?
You see both. And so Alex from Mind talking there, they will be receiving clients who are presenting with mental health issues, but that's leading to difficulties in managing debt. So generally people with various mental health issues want maybe avoid dealing with things they might not be able to manage, detail, or keep on top of administration. But equally, people with debt will start to acquire low-level mental health issues and then become more complex as the debt rises. So one can lead to the other.
You mentioned there that this research doesn't come as a huge surprise, and I think you're right about that. So should there be more of a link up then between organisations who can provide mental health support and organisations who can provide financial support? Because that's one of the things that this research points out, that actually you might go to the NHS, you might go to get some help with your mental health, but they might not necessarily know how to signpost you to somebody who can help with your finances.
It's absolutely right. And so that's the best part of the research, really making recommendation to change the way that people can get support. So getting links between health and, for example, charity support and debts is still very difficult. And we work every day to try and improve that. We are due to move into the same building as Mind, for example, in Durham, to try and make sure that we provide linked services much more easily for clients that have these types of issues. But we do need to better understand the links between life's issues and health and life's issues. We still don't try and treat those things holistically.
Tell me a bit more about that link up you've with Mind, which sounds really interesting. Is that born out of this sort of research, that you realise that you're quite often helping the same people?
It's partly out of research, partly a lot of data analysis down the years. It's also out of running certain programs of work where we try and help people deal with things like finance and housing and relationships. And we noticed that, well, if you have any significant mental health challenge, even with low-level anxiety or depression, you will struggle to implement the advice and support that we can give you. And so working with an organisation like Mind's key, because we can work together, we can case manage together to try and help the client to resolve multiple issues and to make sure one isn't a barrier to solving another. So we're due to collaborate on a building in Durham very shortly, but we've been looking at closer strategic ties for the last 12 months. So we're looking forward to try and bring the services together, both within the charity sector, but also work with organisations in the NHS, for example, to make sure that there's no gap when people get the support much more quickly to resolve their issues in the way that they wish.
And that's key, isn't it? Because I know when we've done stories about mental health in the past and some of the issues that the Suffolk Foundation Trust has had, when we've discussed that, often one of the big complaints and one of the big concerns is that people have said they have to go back to the beginning and they have to tell their story from the start so many times to so many different organisations. If there was, I know it's difficult, but if there was some way that you could tell your story, you'd then get the support from whichever organisation could support you the best, and you didn't have to keep telling your story and keep going through it all. I feel like that would make a difference to a lot of people.
Of course it is. I think the trust that you build up through working with somebody that understands your situation and you can go back to is really important as well, particularly for people who might feel isolated. They might feel ashamed or hopeless when it comes to significant debt in particular. So that is really important. And we're trying to do that work across the piece. Citizens Advice has always been a holistic service. So we'll ask you about all of your situation and trying to help you with all of your issues. And we're working with partners across Norwich. Actually, next week we start a new service where we try to share that information in the appropriate way with trusted partners to make sure that people don't have to tell their stories repeatedly. So it's key, making sure that when people raise the issue that first time, when they feel brave, and particularly people coming to us with £20,000 worth of debt that they listen to, and they haven't got to tell somebody else that they're trusted and they feel they've got a solution, it's critical to getting them a resolution.
Really interesting stuff, Mark. We'll talk again about this, I'm sure, especially with more organisations in Norfolk. By the sounds of it, getting ready to work closer together. Mark Hitchcock then, who is Chief Executive at Norfolk Citizens Advice. I think throughout this, if you've got issues financially or mental health-wise, the big message we've heard from all of our guests this morning is that there are organisations that will support you or will do their best to support you. So try not to suffer in silence. If you can, go out there and speak to Citizens Advice or Mind or any of the other organisations we've spoken to today. They will at least be able to point you in the right direction for some support.